Good afternoon. My name is Amber Smithson. I'm the Director of Business Development here at Bakersfield Behavioral Healthcare Hospital. I am pleased to welcome you to our first meet and greet event. I'm hopeful that we'll be able to do several of these where we will be able to introduce different individuals that make an impact and help change mental health one step at a time here at Bakersfield Behavioral Healthcare Hospital. So to start off with, I thought I would do a little bit of an introductory as far as the hospital is concerned. So we are the only privately owned psychiatric and medical detox hospital here in Kern County. We're actually one of only 11 hospitals in the state of California that are able to help and service individuals as young as 5 years old. Not only do we have 90 beds inpatient, we also have two amazing levels of outpatient services through our program, Stepping Stones. Today, we are going to be introducing you to Jeff Chin, who is our CEO, Stephanie Conrad, who is our CNO, and Randy Beasley, who is the director of our outpatient program, Stepping Stones. So to start things off, I'm going to take things over to Jeff Chin. And Jeff, if you wouldn't mind introducing yourself, telling us a little bit about yourself and what drew you to this profession in this hospital.
Okay. Thank you, Amber. Like Amber said, my name is Jeff Chin. I'm the CEO of Bakersfield Behavioral Healthcare Hospital. I have many years of experience in hospital operations, mostly in the med-surg arena. I've been working at Bakersfield Behavioral for the last 3.5 years. And what drew me to behavioral health in general, and specifically Bakersfield Behavioral, was there's a family history of some depression. So that's one thing that's made me keenly aware of behavioral health issues. And then the great need here in Kern County and also in the Central California area for mental health services. As Amber mentioned, we're one of 11 providers in the state that takes children as young as 5 years old and adolescents. And since there is such a huge need, especially in light of the COVID-19 pandemic, I think it's important that we provide these services to the community of Bakersfield, Kern County, and our surrounding areas.
Thank you very much, Jeff. It has been wonderful to have Jeff as our CEO, and also to welcome Stephanie Conrad, who has been with us for several months now. I'm not sure exactly what it is, but she can let us know. So Stephanie Conrad, our Chief Nursing Officer, please tell us a little bit about yourself and what brought you to the mental health field, and in particular, our hospital.
Hi, everyone. I'm Stephanie Conrad. I'm the Chief Nursing Officer. I've been here for almost 9 months now. I've been bedside nursing, in the nursing field for over 10 years, leadership for over about 5 years now. And I had my first leadership role right out of NICU into behavioral health. And that's where I found my passion in helping this population. And so from there, I was Director of Nursing Behavioral Health, and I was a corporate nurse in behavioral health. And so I found a new home here at BBHH and want to continue my passion with helping behavioral health here in Kern County.
Wonderful. Thank you so much, Stephanie. So last but certainly not least, Randy Beasley, who is our new Director of Outpatient Services for Stepping Stones. Randy, same questions. If you'll tell us a little bit about yourself and what drew you to our hospital and mental health in general.
Sure. So my name is Randy. I started a career in behavioral health, early 20s. And so working in an RTC program. So I was a wilderness director there and kind of intensive services for emotional growth. Did that for several years, and then moved into management of adults with developmental disabilities. So I managed a program there in Riverside County for several years. Managed camps kind of in between. Really found that mental health was just where I needed to be. And so kind of getting into how the brain works, how do we change things? How do we kind of mend relationships? What does function look like? Went back to school, did therapy, studied that. And so started there working kind of intensive programs with LA County. So wraparound, FSP, TAE, working with a lot of foster homes. And then transitioned into forensics. And so worked at Lerdo, which is a facility out here in Bakersfield for several years doing competency to stand trial. And then continued, here in Kern County. Really, Bakersfield Behavioral, I think it's a great opportunity to especially the IOP program, to blend kind of this, how do we manage kind of intensive services and the need for intensive services within an outpatient setting, and kind of come full circle with linking inpatient to kind of outpatient to kind of step down and hopefully community resources. So
that's great. That's great. All right. So I'm going to go back to Stephanie for a minute. As many people can probably imagine, there is always this huge need for compassionate, empathetic, trained individuals to join our forces. We are currently looking for therapists. We are currently and always looking for registered nurses. And so, Stephanie, maybe we can start with you. Talk to us maybe a little bit about what you're looking for as far as registered nurses. What kind of qualities does an individual really need to have and possess to be successful here at the hospital? And if somebody is interested, how would they make those first steps to try to join our BBHH family?
Sure. So, we are open to bringing on new grads or seasoned nurses. The things that we are looking for in our employees is that you have a passion for helping people and patients and being patient advocates, and not only just patients, but in behavioral health. And so, if you don't have behavioral health experience, but you have a passion for helping people and you have a willingness to learn, we are more than willing to help train you and get you ready to be out on the floor working with this population. And so, like I said, just a huge thing for having a passion for this population. If you're interested in becoming a part of the team, I would encourage you to go onto our website and apply. There are different positions open. Like Amber had said, there's positions for therapists, registered nurses, mental health workers, LVNs. So yes, I would encourage you to go to our website.
Absolutely. And I know that right now for our RNs, we are offering some sign-on bonuses for the positions that are apply for that, right? So, there are some stipulations, but it would be definitely something that you should ask either Stephanie or our HR department about to see if you qualify for those sign-on bonuses. Randy, can you speak a little bit about the therapist positions and, what we're looking for at the hospital and what would make the ideal candidate?
Yeah, I feel like I'm going to probably echo what Stephanie's saying, and that I think the biggest piece is going to be passion for this population. I think there's no substitute for that. And so passion and then willingness to learn, that you can kind of come alongside. This is very much a team effort. A lot of what we do is working together to, in an interdisciplinary way with a psychiatrist, with nursing, with community resources to kind of piece together a treatment plan and manage groups. And so I think, teamwork, but like Stephanie said, really passion is kind of the name of the game within this field. And so we've got several positions open right now for therapists, for substance counselors. So those are kind of the spots we've got. The format for IOP is a little different than what maybe people conceptualize, in that everything really runs in kind of a group modality. And so, on site, we're doing groups on Tuesdays, Thursdays, Fridays. So 3 groups a day for our IOP program. For PHP, partial hospitalization, we're doing, 5 groups a day, 4 groups a day, 5 days a week. And so it's a bit more intensive in service provision. Yeah. So it's a little different. We'll do some case management. We do some individual services as well. But a lot of what we do is really kind of in a group format, which is an opportunity for many therapists. It's a very different dynamic to step into a group and kind of manage a group versus just doing an individual session. And I think it's something that there's a ton of opportunity in those spaces. So.
Wonderful. Well, thank you. So I'm going to kind of go back to Jeff for just a quick minute. So Jeff, if you had to kind of explain your ideal employee for this hospital, I mean, you are the chief executive officer, right? So when you're thinking about those ideal employees, what does that look like to you? What are a few words that you would use to describe the most successful and ideal candidate for this hospital?
I think an employee that comes to mind would be one that has a willingness to learn, that has the ability to critically think, that also has a passion for what we do and genuinely cares about the patient population that we serve, and cares about other people just in general, because this is a people type job. Not only are you working with patients, but you're working with several different types of other professional individuals. And so someone that can work in different environments and just wants to contribute to the overall goals that we're achieving here.
Absolutely. So in close, I would probably want to express to you as our community, 1 in 5 individuals struggle and live with mental illness. And we saw through this pandemic an increase of around 31 to 33% of individuals that were seeking out mental health help here in our community. And so as you can imagine, the need for compassionate, empathetic, amazing people to join our team is ever growing. We understand at BBHH that there is this tremendous need for good quality care when it comes to mental health and addiction services. And we want to be able to provide those services to our community at large. And we really need those individuals that have a desire to be a part of an amazing team and to make an amazing difference, to call us, to get online, go to our website. It's bakersfieldbehavioral.com. If you go on the top right-hand corner, it's going to say careers. It will have a list of all of our open positions, and you will be able to apply directly there online. If you have any questions, there is a contact us button on our website, or you can email abk.marketing@bakersfieldbehavioral.com. You can ask us any of the questions that you may have. If we can't answer it, we will get you to the right person that can answer those questions for you. I invite you to visit our website often. I invite you to go to Facebook and to YouTube and to, follow us on those different platforms so that you can get up-to-date information. Our whole goal is to educate and advocate for our community. And we really want you all to be a part of that campaign and that goal that we have for our community. So until next time, thank you very much, Jeff and Stephanie and Randy, for joining us today. And I hope you all out there in our community enjoyed this event, and keep an eye out for the very next one. Thank you all. Bye-bye.